Hi, Shonda. How are you?
Hi, Patrice. I'm doing well. How are you?
Well, thank you. It was a busy weekend and probably going to be a busy week, but I'm glad that we can take time out to talk about some important information and just updates. And today we're talking about something you brought to my attention last week, a article or information about what the CDC has recently started advertising. Do you want to take
Yeah,
over?
and we'll definitely put a link to this article. Well, it's a few pages. It's a website, and then there are a few pages, to look around on, and I found it interesting. And then I wondered how or who was responsible for implementing it, but who takes action on it? That's
Well, that's the $1 million question, Shonda. And I think we could do another whole podcast about that after researching it, because you know what? Honestly, even answering that question, I wonder even if we could answer the question. I don't know if it's being done. I don't know if it's being done. Even if we could identify who's supposed to implement it, I don't know if it is actually getting implemented or if people are actually getting the word and schools are actually rolling out things, new programs. And I guess we should go back to what was this website, or what is it entitled, or what were they talking about?
hmm well, the link that caught my attention is poor nutrition. It talked about it says the CDC works to reduce the four main risk factors for preventable chronic diseases. And the four are tobacco use, poor nutrition, lack of physical activity, and excessive alcohol use.
Yeah, well, it caught my eye because we've been hearing CDC this, CDC that regarding the vaccinations, regarding the whole COVID. So, not that that's not important information, but this was a good break about other important information, because with COVID, we have heard a lot about the vaccine, which I'm not saying that's not good, but we have not heard as much about the importance of nutrition and a healthy immune system. And so to me, this was like just a light bulb moment for maybe our government, because I guess the CDC is a government entity. I guess, but that they understand that there is a link between our health and what we eat.
Yeah. Well, the CDC has published that, but they don't promote it, or let's say news media, whomever is responsible, they're just talking about what the CDC says about COVID, but what does the CDC say about COVID and its relation to poor nutrition?
Hmm.
I don't we don't hear that often.
No, but I also wondered how recent is this information? I didn't see on the website. Is this something very new? I don't.
I don't think it's new. Every no, but every 5 years, I think they put out a nutrition report or something like that, or recommendation guidelines. I know they do uh the like the pyramid food eating guideline that we
Hmm.
have here in the U.S. I know I think they do that every 5 years. They
Okay.
update that. So, this is just kind of a part of it. Yeah, there aren't any dates on the article or anything like that.
Hmm. That's a good
But
point.
yeah, I mean you know, it talks about the harmful effects of poor nutrition. And here's the list. It says overweight and obesity, heart disease and stroke, type 2 diabetes, cancer, and deficits in brain function. So
Hmm.
it's addressing all the things that we know are very high, all the diseases that we know are, you know, what's it?
Prevalent.
Yeah.
Mhm. Yeah, they're prevalent in our society. And so I'm just, again, maybe I'm just being very optimistic, but I have never seen anything this closely related to um, the truth about the connection between our nutrition and our health.
That the
Because like
government
you,
had produced.
yes, yes, because
Uh-huh.
like you just mentioned the food pyramid, and I'm not trying to knock the food pyramid, but it's evolved over the years, and it still has some some work to be done on it. But
For
there was
sure.
a time when it was, oh, I think, they've improved a lot on it, but there's still room for improvement.
Mm-hmm.
But yes,
Yes.
it just seems like this particular website is trying to finally hone in on some things that may not be as popular, but they are realities. For example, it may not be popular to talk about just how not nutritional or not healthy our school lunches are. We know that's not a popular topic because this is a sidebar, but there was a chef, Jamie Oliver, who came to America, and he was just trying to show how we can change what our children are eating, because in some countries like France, they eat real food at
Mm-hmm.
lunchtime.
Mm-hmm.
And
Yeah.
so now we see them actually addressing, they're not taking it to that level, but they're at least addressing that there's a connection. And I think one thing they talked about was offering more salad bars at school. And I don't believe I ever had a salad bar offered in public school when I was growing up, which was a long time ago. But even I don't even know if my children did, but
Yeah.
that's a
I
positive.
think there were a little bit of salad. I remember this was high school, maybe. I
Okay.
remember maybe.
Well, maybe high
Maybe.
school,
Maybe.
definitely not middle or elementary, where the kids, their brains are developing very rapidly. So now that you mentioned maybe high school, but hey, we need to back it up.
Oh,
Go back to the
definitely.
beginning. And I did notice that the CDC even talked about the benefits of breastfeeding. Now we understand not everyone can breastfeed. I mean, there's can be some health limitation. We're not talking about that situation, but we're talking about the situation where you can
Mm-hmm.
breastfeed, but you just choose not to for whatever reason, um, and maybe not even knowing
Yeah.
just what benefits there are.
Yeah, not knowing, and it's not the norm, you know.
Yes.
So, yeah, that would be something that would be helpful during the time that you were preparing for giving birth to talk more about it, you know. Yeah, I know that it wasn't spoken about. What my oldest, what, 24 years ago when my son was born, and
Mhm.
I only heard about breastfeeding or the encouragement of breastfeeding because I did a few homeschool um, communities, you
Okay.
know. But yeah, anything with dealing with the hospital, my doctor, or anything, I do not remember any encouragement there at all.
Wow. I did have some in that those classes they offer while you're expecting.
Hmm.
Maybe there was a lactation consultant who came and spoke. I don't remember exactly who, but anyway, there was that at least information provided, so that was good. But I've met so many people where they're just not even aware of the benefits, like we said, or how to do it, and also to not get discouraged because it may not be like something that is, it does may not go perfectly the very first try, but that doesn't mean you don't try again.
Yeah.
But yeah, I think you're right. It's about getting information out there, and we don't want to harp on just breastfeeding, but the reason we brought it up is that that's starting early.
That's a
Yeah,
good foundation.
great foundation. And even if you're not able to, um, well, if you are breastfeeding, another thing that comes up is that you're thinking more about what you're putting into your own body,
Mhm, mhm,
because you're making that connection that what
mhm.
I'm eating is going to what my child is eating. So that was just, I was thinking it's optimistic that they at least went back to the breastfeeding, the beginning, a foundation there.
Yeah. So where do we go from there? You know, okay, so I was thinking about this. When way back when, I don't know how far I have to go back, but I know that a lot of people, when I was learning about nutrition, still didn't make the link of nutrition to health.
Hmm.
Okay. And I was there too. I didn't have access to anyone telling me about nutrition. I do not remember this in my childhood at all, you know, so I'm sure that this still exists because, well, you know, maybe it's a little better now. We have the internet, we have the internet because it's not on a commercial on television. You know, it's all about the medications. Oh, skip the food. We'll just give you a medication. So I won't go there. That's my soapbox, my very big soapbox. But so I do understand there's lack. I just wonder, where is it the individual's responsibility, or where do we, is the doctor's responsibility? You know,
That,
people go to doctors for advice, but
hmm,
doctors don't get nutrition most. And I hear it all the time from doctors. There's no nutrition studies when you're becoming a doctor. And I'm like, that is crazy. You know what I mean? People are depending on doctors for health. They trust doctors, right?
hmm,
So I think that's a big mistake for these medical institutions. And I don't know why this would still be the case in 2021 after we've learned better, but I just think, a lot medicine is all about, well, we want to know how to fix it. Let's fix it. We want to develop that. They want to develop that medication, they want to develop that procedure. What about preventing the chronic disease in the first place?
Well, I think you bring up a lot of great questions, Shonda, and as for who is responsible, I think it takes everyone. It takes the parents, it takes the community, it takes the doctors, it takes everyone getting involved, and it also we need to, um, for example, in that same on that same website, when we think about after the infant stage, oftentimes, and I forget the statistics they shared, like you said, kids are going to school, or even before school, they're in childcare because a lot of parents work, or both parents work. So we're taking our kids from home and then entering them into childcare and or the school system. So that is where maybe the government comes in.
I would like to see the government take a stand and say, hey, we need to do better with our school systems food service. That would be wonderful. That would be amazing, because then parents would see. So if this government would do it, I'm not saying people who are ready to do this for themselves depend on the government, but I'm saying that it would be good for the government to take the stand. It would be good for the doctors to take the you know, standpoint and say, this is the nutrition that you need. Why? Headlines, it should be a headline. And I'm thinking now, when I was a child, I had asthma, right? But not once, they talk about, well, they didn't believe tobacco use led to chronic diseases and things. I don't remember once anyone relating, oh, well, your parents smoke. That could be why you have bronchitis. I never heard any of that. It was just like, oh, well, here's a pill and here's an inhaler.
Wow, that's a lot to just think about. And I guess it goes back also to, it takes everyone to ideally get on the same page, but also that we, at the end of the day, we have to be our own advocate. And so that's why we're always available to research other questions, and to share what we know, and anyone else knows, if anyone knows things that we can share, we need to do that. And so this and other, we can't just rely on other people to always bring it to us, but to be proactive ourselves instead of
Yeah.
reactive, and be intentional ourselves about, well, you know what, I want the best for myself and my family. What does that mean? And where the government can come in or chooses to, that's great. And where the community does, that's great. But at the end of the day, I think it goes back to personal responsibility.
It
And
does, but
yeah.
when we think about the children that don't know any better, you know.
Well, that's where the schools might be able to lend a hand, because it is, not to get political or anything like that, but public schools are paid by tax money. And so if we know that this is going to be better for the kids, then we know there'll be less bills, there'll be less absences, there'll be more learning, there'll be greater brain function because they're getting fed well, so their brains are being fed well. I was just listening to a doctor the other day, and she was saying just even hydration. If you're dehydrated, your memory could be lapsing here and there. You're not getting your full cognitive
Yeah.
function.
So let me have my water here because, yeah, I don't want to miss anything.
Good. Going back to the website, I guess this might be a start that at least we've read this website, and even though most of its information we already were on board with, we can now use this link to share with other people who may not listen necessarily to us or our community, but if they see it in black and white on a website, they might wake up and say, oh, let me check this out.
Hmm.
Because you brought up great questions, and especially about how is this being implemented, and I just don't know if it is.
I'm looking at the website now, and it has, I mean, just that it does definitely link poor nutrition to chronic diseases.
It does. And I did notice that it also then talks about healthier options for childcare, healthier options for school. So at the end of the day, if there's a link, then what are we doing about the poor nutrition? So that's maybe something we can camp out on for a minute. In that, for example, we talked about the children, and I think we've mentioned it before, and they may mention it in this. I think they mentioned it on the website that we need to start re-educating or educating for the first time to children. There is something called farming. These foods that you're getting on your plate are actually grown in the dirt, in the field, and then they're harvested. And then also having a community garden at schools or in the community. And also realizing that the chickens that we see, chicken nuggets, is very popular for kids, but they don't have that connection that chicken nuggets came from an actual live chicken
Hmm. What
that was.
part of the chicken is that? No, that's a joke. Okay.
Oh, never mind. I forgot. My point is, well, I do want to talk. We do promote a mainly plant-based diet, but we understand that our audience, they're not everyone. That's not for everyone.
Uh-huh.
It's
Yeah.
not. And so it is important though for our community to realize that even if you're eating meat product, especially if you're eating animal products, you do want to know where they're coming from.
Yeah.
And it's good to start educating the kids about the food that they eat, the
Hmm.
plant-based food, as well as if you're eating animal products in your family. We still want to know, how do those get on our plate? Because I know it's hard to understand, but a lot of children, they have no idea about farming and raising animals. That's one thing I never got to. Is it FFA, Future Farmers of America? It's in high school,
Hmm.
but I will give it to those kids. That's something they actually got their hands dirty in. They found the responsibility, and you don't take for granted as much the food that you're given to eat, period,
Hmm.
because you understand what it took to get that food. Plant-based food too, because it takes something for the patience, the diligence to grow good, healthy crops. So again, I guess it goes back to education, education, education. Not sure where the education is coming from, but at the end of the day, we can educate our own selves and our own families and beyond where we can. We can
Hmm.
educate those beyond ourselves where we can.
Hmm.
But
Right. And, that the CDC has made this connection. I mean, that's an entity that many people trust and put their, make decisions based on. So that's a good thing.
I think another thing that came out of this website, or just reading what was provided on the website, the mention of chronic diseases, just the
Hmm.
fact that they're acknowledging in one place, not just one, but several chronic diseases like heart disease, diabetes, things that unfortunately people have come to just assume after living a long period of time that I might get arthritis, I might get heart disease, I might get high blood pressure, all these things. And don't get me wrong, sometimes we do get those things no matter what we do. But we need to be also honest that there is a connection with how we live, our lifestyles. And part
Right.
of our is what we're choosing to eat. So
Mhm.
I think it's good that they're highlighting that there is a connection so that we can understand, yes, there are all these chronic diseases in our country that many people are battling, but let's back up here and look more so at how we can prevent and be proactive. And with proactive being more intentional
Mhm.
about making new choices. It's never too late to make a change.
Yeah. Yeah. One thing that I know I remember hearing, some of the doctors that I follow say is that, you may have the gene for that disease, but you just determine whether you turn that gene on or not, according to your lifestyle, diet and lifestyle. So that
Amen.
is something to consider, because don't just say, well, my father had it or my mother had it or whatever, grandma, that I'm going to have it. I hear that a lot too, but there are doctors that say, no, that is not true. You do not have to, be in that condition.
That's a
So,
very good point, Shonda.
um,
We don't have to be in that condition. So focus on what we do so we can try to work towards not being in it.
yeah.
What-
And the only other thing I was thinking about is that, we know from graphs, information out there, that these numbers are rising. So
Mm,
there has to be a question. So why? Why are these numbers rising? you know and a lot of other information suggests it is the food and the way the food is prepared, and what people are eating, the increase in certain foods, refined foods, a lot too much animal products, and there's correlation there, and our environment, which we'll talk about soon
well,
too.
yeah, the environment too.
And
That's
our
a
environment, and environments sometimes that we create, so we'll talk about what some things that we can do, but the numbers are getting higher. Why? That's just something that,
not only are the numbers getting higher, like you just said, but also the population of people being affected is
oh,
becoming younger. And that's a great point about the whole correlation because, again, not to belabor it, but like living in another country for just a short while, their country for years had lower numbers in made like cancer, for example. And now they're doing studies, and there's a correlation between their country having a less typical Western diet and now having more of a Western diet,
yeah,
and now seeing increased diabetes, increased heart disease, different chronic diseases. So
yeah,
that is it. Just to your point, there is a correlation between our nutrition and our health.
yeah. And there's one particular that I just saw last week, and I can put a link there. It was through the Physicians Committee. Did you see that one about India, about what's happening in India? Very interesting.
Oh no, about the COVID? About
Uh,
COVID?
well, COVID is having an effect, but why? Why are people more sick in India than they were? They had a time frame, and it is because they're more Americanized. They want
Hmm.
to be more like Americans. That was sad for me to hear that. They want to be more like Americans, and so they're taking on the diseases that we Western, community, whatever, have.
That is so true. I mean, again, having been in Asia just a few years ago, but then I can also, I was just fortunate to go back in college like 30 years ago, or yeah. And I remember from personal experience, hardly ever, I don't think we ever saw a pizza place. That was not even something you could do. And seldom fast food restaurants. In these same countries, it's on every corner now. Things like ice cream and bread were bread, like, I mean, the processed bread, not the fresh baked bread and all that. Those things are just all over the place now. And you see different diseases now.
Yeah. Remind me to put that out there, because that was very
I
interesting.
want to read that. Yeah.
Um,
Well, Shonda, I just wanted one thing. I didn't see it in the website either, but when you mentioned environment earlier, I was thinking it came to mind about the environment we either create ourselves or the environment we allowed ourselves to be in. And what I'm referring to is stress. And don't get me wrong. I understand we cannot avoid stress, but we can be responsible about the way we handle stress. That is something I constantly have to work on, but at least I'm aware of it. I'm aware of it more now, because before it's like I go through and I'm like stressing out, but I wasn't as aware of the ill effects of stress. But now being aware of it makes me try to minimize it. And when I face it, to respond in a healthier way, if that makes sense. So not to get sick. I mean, I think a lot of people, for whatever reasons, maybe they have multiple jobs, maybe they have illnesses, maybe they're just going. But all these things can lead to stress. And I've had more than one person tell me they've had panic attacks, or they've had heart palpitations, all these things where they've had to get it checked out by the doctor, only to learn that it wasn't a physical, it's stress induced.
Yeah, I agree. So yeah, that's a good point to make at the end of this podcast, because that's something that we all need to be aware of, and something that I'm not going to say can easily be changed, but it's within our control. Most of it. I mean, eventually it is. Ultimately, we may have to remove ourselves from situations, but most of us are responsible for that. So stress has a big impact, like you said, on our health. And that should be an area that we don't overlook. We cannot overlook it.
All of us can just do better. And whether it be yoga or meditation, and for those who are Christ followers, believers in Christ Jesus, then meditating on God's word.
Mm-hmm.
And even just music. I've even had my college age kids telling me about how they take time to breathe and start their day more calm, to
Mm-hmm.
carry them through the rest of the day. So I think we shouldn't take too lightly uh, just what a negative effect stress can have. And although we will have some stress, it's important how we're managing it.
Physical activity was mentioned in the article or the website. And so that can be a great tool for handling stress or relieving stress, you know. So that's something that I didn't want, you know, that I wanted to bring to someone's attention. So I may highlight that part too for you, physical activity in that article.
True. Yeah. Good point. I'm glad you didn't forget that.
So unfortunately, the article does say, you're not aware, most Americans, however, do not have a healthy diet. And it talks about good nutrition is essential for keeping Americans healthy across the lifespan. And that the CDC supports breastfeeding and healthier food and drink choices in settings such as early care and education facilities, schools, work sites, and communities.
Mm.
So that's definitely where the news needs to be spread. And I
Great.
guess, like you said, we can all do our little part in spreading this news and just sending a little link below our email. The CDC says, look at this article. I don't know.
Yeah, that's a start. And just encouraging our friends and loved ones, anyone just trying to make just one change, encourage them. And then, encourage them to make the next change and the next change. And that's it's one day at a time, one change at a time.
Yeah, one day at a time, one change at a time.
So true. So true. So again, Shonda and I are always ready and willing to receive any of your comments, any questions, so we can research them or just talk about them. But we are here for you. If there are any questions or anything you need support about, we'd like to support you.
Yeah, we really would. We hope you enjoyed watching today's video of our podcast. A link to the show notes can be found below this video. Also, please subscribe so you won't miss any future videos. And be sure to comment below and let us know what you think about this format. Until next time, let's just be real.